let's take your shirt off.
Go ahead and talk to him.
All right, we're here with a patient who has a severe cervical myelopathy secondary to cervical spondylosis. His MRI scan shows us that he's got a congenitally small spinal canal along with disc that's osteophyte complexes that are producing fairly severe stenosis at C4-5, especially at C5-6, and again at C6-7, and you can actually see the abnormal signal, the myelomalacia, which shows up as a white spot inside the spinal cord at that level. Here's a cross-section of what his MRI looks like, and you can see the distinct white spot just to the left of midline corresponding to the myelomalacia. This has been going on for a long time. Normally, bulges a little bit between the thumb and the index finger. If we turn his hand sideways, you can see how it's actually scalloped and significantly atrophied. The other thing that he exhibits is significant weakness of his triceps muscle and also spontaneous fasciculations of his muscles. David, if you take a close look here, if you kind of focus on his forearm here, you can see the muscles twitch spontaneously. You able to appreciate that? Mm-hmm. Again, consistent with damage to the lower motor neurons as a result of long-standing spinal cord compression. When we check his strength, I'm going to have you pull muscle toward yourself and check his bicep strength. His bicep strength, basically normal, but when we have him hold his arms out to check his triceps, and we're going to have you push out for me, you can see that I can just push him down with just 2 fingers. So he's a big guy that weighs about 250 pounds, but you can see how weak he is in his triceps muscles. And you can see that he's got some atrophy along the lateral and long head of the triceps as well, and then you get an idea of the fasciculations. We're going to have you bend your wrist back and keep your fingers nice and straight.
That's as straight as I can get them.
Okay. And you'll see that he does have a little bit of weakness of his wrist and finger extensors because the C7 nerve root also goes to those muscles in addition to the triceps muscles.
What would the treatment for this condition be?
At this point, he is going to need a decompression of multiple levels in his neck. We're going to do an anterior and a posterior cervical decompression with the fusion instrumentation from 4 to 7, the hybrid cervical corpectomy and discectomy with a plate from the front, and then a C4 to C7 laminectomy with lateral mass screws and instrumentation from the posterior approach, and that'll be done 2 days apart.